Good morning, Laura. Thank you for coming. Today we have Laura Haraka from New Jersey, and she has an inspiring healing story, how she healed herself from issues that started in 2015. And Laura, please tell us how everything started.
Sure, I'd love to. Just so you know, my intention for sharing this story is just to reach out and give people as much hope as they can, because there is plenty of hope for people with chronic pain. No one has to have chronic pain or has to suffer. So that's the reason I share my story.
Thank you.
Yeah, my story began in May 2nd of 2015. It's funny how you remember dates, but you remember a date when something happens that you get a pain condition.
Yeah.
So, it started just like any other day. And all of a sudden, out of the blue, I started having UTI symptoms. Okay.
Yeah.
So I assumed I had a urinary tract infection, but I never had one before. So I didn't really know what one felt like, but I assumed. I decided just to, try to drink some water, have some yogurt, just over-the-counter things, but it progressively got worse. So I went to my primary care doctor for an antibiotic, but the funny thing was there was no UTI. They did a test and nothing was wrong. Things did not get better from that point on, and I decided to go to a urologist. I actually went to 3 different urologists because once there was no infection, they all kept telling me I was crazy and there was nothing wrong with me. The third one did unfortunately, some invasive and uncomfortable tests, which had to be done to see what was wrong. They did a cystoscopy and a urodynamic study. Both found there were negative results. There was some inflammation in my bladder, but nothing to the point that should have caused me the pain that I was in. They also did find that I had some retention and urinary frequency. I was given medication for overactive bladder at one point, and I was given medication for retention. Neither one of them.
Diuretics?
They were I can't remember the name. I'd have to look it up, and I can look it up for you and get you the exact names.
Oh, no. So yeah, they thought that you have an inflammation in the urinary tract, and so they gave you a treatment, medications to this condition, but
yes, Mebetrix, I think is the name of it. So they gave me that for the overactive bladder. They gave me a different one for retention because they were trying different things to see which one it was. I went to another doctor, a urogynecologist. He did another urodynamic study and basically told me I was crazy and I needed to go to see a psychiatrist.
Yeah.
Yeah, so I actually left there in my car sobbing.
Yeah. Well, many times they are guessing because they don't know.
But I knew something was wrong. I was having symptoms because even though they didn't find anything at the time, my symptoms were real.
Of course. How was your blood test? Did you have indications of inflammation?
Some of my vitamin levels were a little low, but I'd say at least 13 vials of blood at different points. And they still weren't finding too much there, but I felt inflamed as well. Like I could feel the inflammation in my urethra.
Mm-hmm.
So over the next few months, I developed something where I call chronic pelvic pain. I was feeling many different things. I was feeling sitting down was very difficult. There was pain in sitting. It was almost like the nerve was like compressed. I also had more bladder symptoms at the time. And I also, so I went to a few doctors.
Yes.
And I was diagnosed with something called PGAD, persistent genital arousal disorder. That was one of my first diagnoses. And it's an awful condition that women and men get, where they can feel aroused without any sexual intercourse, any sexual innuendos, any, trigger for it. You're just aroused without anything. You can be doing the dishes.
Yes.
And, so it's a really uncomfortable condition.
And it is a torture, I understand.
What's that?
Is it a torture?
Torture, yes. Yeah, it's like having an itch you can't scratch. It's, you feel like you're going out of your mind a little bit having it. I went to see another doctor, and he told me I had, the cause of this was interstitial cystitis, which is an inflammation of your bladder. And that if I went on a special diet, I had to give up everything: gluten, soy, corn, dairy, caffeine, you name it. I couldn't drink a seltzer, anything carbonated. So basically they took everything out of my life that would be enjoyable.
So what did you eat back then?
Everything was, I ate some salad. I ate grilled chicken, everything very bland. It was a very bland diet I was on. No coffee, nothing acidic. So like no salad dressing, no lemons, no ketchup. I ate very bland food, maybe some potato or rice. They gave me aloe vera, which it didn't really help.
It is considered anti-inflammatory, and it is cooling the system.
Yeah, it didn't help too much. So I went to this doctor, and he did bladder installations where I'll tell you, they catheterize you right there in the office. And I went monthly for this, for bladder installations. And they did these installations, and they sent a medication up to my bladder. And
to deliver the medication directly, locally.
Yes, they deliver it to your bladder. And I did that once a month. I went up there to Pennsylvania. I drove an hour and a half once a month to get these bladder installations. And what they did was they taught me how to do it on my own. So I learned how to catheterize myself.
Ouch. It sounds
I learned how to do it myself. So I could do it weekly in between these appointments. And I would, I knew how to give myself the medication. So it wasn't really a fun thing to do, but I learned how to do it. The problem was I wasn't really getting better.
You also mentioned before that you had other diagnoses like Tarlov cyst or...
Yes, I'm going to get into that. The next diagnosis that I had was pudental neuralgia, which is a condition that a lot of women suffer from. And it causes a lot of pain in the pelvic area. And it's hard for women to sit. They need to sit with a cushion a lot of times. And they can't wear restrictive clothing, which I was not able to wear jeans or anything like that. So I would they did a few injections to see if they could numb the area, to see if that helped. And I also had Botox injections at the time, all done internally.
So it seems like they suspected it was something neurological. No?
They did, yes. They felt like it was neurological. It had something to do with the nerves. They did. The bladder, they felt like there was just inflammation in the bladder. But every time I went to a different doctor, the doctor for pudental neuralgia, that was his specialty, he said I had that.
Yeah.
The doctor that specialized in IC said I had that, interstitial cystitis.
Yeah, because if you have a hammer, everything is a nail.
Yes. Yep. Exactly. So I did that. I went for Botox treatments. That didn't work as well. I went to orthopedists to check because they had said I had a herniated disc, and they did another procedure where I'm not sure what it's called, but they did an injection in my back to numb there too and see if that would stop the pain, but it didn't. I then went to an interventional radiologist because they did an MRI and they found pelvic congestion syndrome. Pelvic congestion syndrome, sorry, is varicose veins in your pelvic area. And what the
like hemorrhoids?
No, these are actual veins that are in your pelvic area. They're like varicose veins that are in your legs,
yes,
but they're in your pelvis.
And
the doctor told me,
do you see them? Can you see them through the skin?
No,
they are.
You can't see them through the skin. No,
I see.
It's internal, not like the legs where you can see it in the legs. So I had this MRI done, and they found pelvic congestion syndrome, and they found this, and they said it was the largest varicose veins he'd ever seen in someone.
And they saw it in the MRI.
Yes.
See.
So I said, this must be it. This must be the cause of my pain. All these, tests and MRIs and ultrasounds that I've had done. This must be it.
Yeah.
So they did a procedure. They embolized my ovarian vein. So they went in through my neck. I was awake during this procedure. And the reason I was awake, this is important to know, I was on Klonopin, which is for an anti-anxiety. And I was also I was in a lot of pain. So I was on Oxy and morphine.
Oxycodone?
So I had a lot, oxycodone, yes.
And what else? Morphine?
Morphine, yeah.
So it's opiates.
Yeah, I was on opiates. And I was addicted to them at that point because I was in tremendous pain, but I needed something to get me through the day. So when they went
what I know is that they almost erase you, and they cause lots of constipation and other side effects. They do
cause things, but I was kind of desperate. My pain was a 10 out of 10. Some days it was more.
How much time did you suffer like this?
I got this condition in 2015, and I started when I found the world of mind-body medicine. That's when I started getting better.
So
and feeling.
Actually, for years you have been with pain, chronic pain 24/7, and 10 of 10. And can I ask you what? Yeah. So you mentioned the modalities that the conventional modalities that you took. I'm just curious to know regarding the symptoms. How was a typical day of your life back then? Mm. And what were the emotions around it? I mean, what was the layer of, how did you feel about you? I mean, it sounds like an obvious answer, but I still want I'm curious to know, did you have a warrior spirit, or you have been in despair?
Not at first. There was no warrior spirit at first. Doctors basically told me my condition was chronic and I'd have to just live with this for the rest of my life and, do the best I can with diet and, do the best to treat the condition, not cure the condition. So when someone hears that changes your whole outlook. You feel like you're stuck. You're never going to get better, because that's what I was told, but it's not true. But a day in my life was a lot of panic attacks because I was so anxious. I knew that the pain was coming and going, and which condition was going to flare up at that moment changed daily. So there was panic, which was going to happen. There was depression. If I did go out of the house, I always brought my cushion with me. I always wore sweatpants. I really didn't have too much of a life with my children, like even getting my younger daughter to sit on my lap. It just, I couldn't have that. So the connection between my kids and my husband was gone. I was like a zombie. I really was.
Just a minute, I am stopping because I have problem in the camera, as you see.
Yeah, I see something. You're.
It's because of the rain. It is. I'm just trying to. Let me try to. With your permission. Wow, this is a very good interview. You're conveying it so beautifully. Thank you.
Oh, good. I hope so. I'm trying.
Yeah, you are paying it forward for your healing. It is kind of. Sorry about that. Let's see. No, still. Just a minute. Here we are.
Oh, good.
Yeah, I resetted it, so just a minute.
Yeah, take your time. No rush.
Yeah, so I'm resuming the. So, Laura, let me summarize what you have experienced. And so, since the year of 2015, you have been diagnosed with several conditions, an acute, oh my God, it's starting again. So, Laura, let me summarize your story as I heard it from 2015. You have been diagnosed with several health conditions, including UTI, pelvic pain, Tarlov cyst, pelvic congestion, which is varicose veins in the pelvis. And you have been giving lots of medications and injections and invasive procedure like catheters to deliver the medication, and nothing helped. And doctors told you that your condition is for good. Actually, it will stay like this.
Yes, it was told it was chronic, and I just have to manage it with pain meds and diet and pills, any kind, natural things, anything I could do to help my pain.
So let's tell me, how was a typical day in your life back then, emotionally and physically?
I guess I would start out with, it took a toll on my life completely. I was in a depression. I had a lot of anxiety. A typical day included panic attacks. My kids, I lost a lot of connection with my kids and my family.
Yes.
My relationship with my husband deteriorated, and I really didn't have any social interactions with people. But I will tell you, I did at the same time try to help myself, and I started a little small business walking dogs.
Ah, nice.
Yeah, because I couldn't really be with people. And I thought if I just walked a couple dogs a day, it would be helpful, even though I was in pain when I was walking. But I thought at least to get me out of the house for a few hours. And then I would come back and I'd be so exhausted and in such pain that I would take my pain medication. I would definitely take an oxycodone. And then I would be literally on a chair for hours, just zoned out from the medication. And my children would come home from school and they really didn't have a mom, which was pretty sad.
Can you hear me?
I can hear you. I can't see you, but I can hear you.
Yeah, I have a problem in the camera, but let's continue like this. It's good enough. The story is the issue, is the interesting thing. How did you feel emotionally about it?
I was a zombie.
Mm-hmm.
I didn't really, it was like I was emotionless unless I was crying over the pain or the depression. I just knew my life, I thought my life was over. I really did. So I felt sad. I felt angry. I felt hopeless. There wasn't much of a future that I could see. And so the depression basically became worse over time, just having to deal with this.
I see. Did you sleep well?
No, I also had bouts of insomnia and the pain actually woke me up at night.
Oh.
Yeah, I would wake up at night in excruciating pain and just taking the pain medicine or different modalities that the doctors gave me. They gave me Valium suppositories, all different things that I could try. I would literally go to sleep with ice packs on me to try to numb the pain. And unfortunately, the ice packs didn't do the trick. I usually had to have a more extensive pain meds, just like I told you with the oxy.
And you were living actually on opiates?
I was living on opioids, yes, along with many other different types of medications. I was on gabapentin. They put me on Lyrica, low dose naltrexone. I had experimental procedures of injections of nerve blocks that didn't work. So yeah, and I also took supplements to try to help myself as well, but nothing was really working too much.
Uh-huh. And let's go back. Which modalities did you use back then? You mentioned the injections, the medications, and the catheters that you had to learn to do to yourself in order to deliver the medication directly, locally, to the area of pain.
Yes, that's what I did. I also, just to mention, I'm in the United States and I traveled throughout the country to different doctors looking for help. I traveled to Texas. There's a Tarlov cyst specialist in Texas.
Oh, yeah, I heard about him. He has like 12 beds in his clinic. And did he help you?
Well, he was a really nice man. I flew there to see him. I got on a plane to see him and I showed him my MRIs and he said that he could see the Tarlov cysts. He said they could be the reason for my pain. However, I had the surgery for my pelvic congestion syndrome and it didn't work. So I was a little leery to get another surgery.
Yeah, of course.
Yeah, so I didn't want to get another surgery. Oh, I was also diagnosed with endometriosis. So I saw a specialist in the city for that, for New York City as well. So I traveled to Texas, Washington, D.C., Tennessee for injections, procedures, different things to try and get relief from this pain.
So can you share did you have a dark night of the soul moment or a time where Do you remember, do you recall any situation when you felt that you are on your knees, that you hit rock bottom? I mean, it sounds like it was a long time, but
Yeah, there were times in the middle of the night that I had a necklace that I would hold on to in the middle of the night. My therapist at the time, she helped me a lot. She's the reason I'm here today.
yeah.
She's the reason, yeah, she actually gave me the necklace. There were times I held on to that necklace for dear life because I just cried because I wanted to die.
Mm-hmm.
I was literally on my hands and knees. Just honestly, I'm not going to sugarcoat it. I was begging for God to take me.
Yeah, I know. It is very, very human. It is a very human need to stop the suffering.
Mm-hmm.
And
Yeah.
so what was the turning point in the plot?
I'll tell you the turning point. The turning point was when I went to my daughter, she was 16 at the time. I have two girls. And she came home from work and told me about a friend that used a hypnotherapist.
Yes.
And lots of doctors couldn't help me. So how was I going to think that this woman who was 30 years old at the time was going to help me? So in 2017, it was July of 2017, I met this woman. Her name is Caitlin Peterson. She's a licensed social worker and hypnotherapist.
Is she an Ericksonian hypnotherapist? You know that Ericksonian hypnotherapist. There is hypnosis and there is the hypnosis of Milton Erickson.
I'm not 100% sure. I could find out for you if you wanted me to. But, you know, I didn't know that when I walked into her office, she was the one that was going to change my life forever.
How? Can you share?
Yes, yeah, I can share. It's actually a pretty cool story. She is different than any other person that I ever met. Her techniques were different. She didn't care about the diagnosis or the symptoms.
Mm-hmm. And
that was the best thing I did. I stopped talking about the diagnosis. I stopped talking about the symptoms. When you talk about it, you give it legs.
Right.
And when you focus on it, it grows. So that was one of the first things she told me to do.
So what you were talking about? What was the substitute?
Okay, that's a good question. Well, the substitute for talking about that was my emotions. I was talking about all the things that had happened in my life, all the things that I was angry about or guilty about or sad about or forgiveness that I needed to have for myself and others. So we dealt with the emotional aspect and not the physical aspect.
Uh-huh.
So that was another important thing. But stopping to not talking about your pain is the first rule or the first suggestion I give my clients. Not to talk about your pain for 90 days and see what happens.
It's easier said than done, because when you suffer and the pain is a very big noise, and the suggestion of the psychotherapist is like a small, thin, weak whisper in the background. Mm-hmm. The pain captures the whole foreground.
Yeah. Yeah, so it's very hard. When I tell my clients not to do that, they say, I don't think I can do that. I said, you can. You can. You're going to start thinking psychological and not physical at this point. So you have to have a shift in your mindset.
Yeah. This I understand. And how soon did you notice a change?
Well, during the sessions, I was able to get my pain down, so that was really cool. And it wasn't going away, but I would get it down. But what happened was I started experiencing a few aha moments, is what I like to call them. And that's when I made the connection that this was a mind-body thing, not a physical thing. So what happened was Caitlin told me to take a meditation class. And as I meditated and I got into this trance state, the same state I kind of got into with her, and watched my symptoms as an observer, the symptoms actually changed over time. Nothing changed immediately. So none of these things I'm going to tell you too happen overnight. It takes consistency, it takes persistence, it takes patience.
Yes.
For all of this to work.
Mm-hmm.
And you have to do it without expecting something's going to work immediately. Things take time.
Yeah, this is, I think you nailed it, because when you expect, you're still fighting it. You're still giving it legs, as you
exactly.
Mm-hmm.
Exactly. What I teach my clients is to practice outcome independence, to do the work regardless what happens of the symptoms. Success lies in how you react to them. If you respond to them and not react to them, that's success. That's when you're teaching your brain that these symptoms don't rule you any longer.
But Laura, what if the patient has already structural changes, deformities in the body? You know, many times it starts as TMS, as a as you say, as a misinterpretation of the brain. Mm-hmm. But because of the inflammation and the constant pain, there are changes that are already taking toll of the body. Do you understand my questions? Someone can be with arthritis, which is manifestation of TMS, but because of the inflammation, there is a fusion of the joints, or which is like a consequence of the constant inflammation. Does he also have a hope?
Everyone has hope. Everyone has hope. Their acute pain, everyone heals from. No one has to have chronic pain. Chronic pain, and some conditions are not TMS. And that's why I recommend going to a TMS doctor to get diagnosed. I see clients, and if I will take their diagnosis if I'm not sure. Most of the time, I'm sure what it is. But if there's a diagnosis that I'm not sure about, I will see a TMS doctor. I email them, find out their diagnosis, and let me know. Not all conditions are TMS.
I see.
We can't just eliminate the medical possibilities. However, I had Tarlov cysts. I had inflammation. I had pelvic congestion syndrome. So people have abnormalities in their body, which are called normal abnormalities.
Yes.
It's like if you see a baby and it has smooth skin, and you see an older person with wrinkly skin. Both are normal. But if you compare the two, they would be abnormal. But neither one of them is wrong or causes pain.
Wow.
It's just the analogy I can give.
It's a beautiful analogy, a beautiful metaphor to hang to when the doubts creep in. Can I ask you, so from 2017, when you have seen that hypnotherapist till the moment that you healed, what I'm asking actually is, when did you know that you are healed? That you were healed completely?
Oh, when did I know it was healed completely? well, I guess I'd have to start out first by telling you there was another aha moment, and then I knew that I was on the right track, which is a pretty interesting story, and I think it's worth sharing if you have the time.
Yeah, please do.
Yeah, it was the most important thing actually that happened to me. This therapist, Caitlin Peterson, her name is, she was my lifeline, and she still is. She saw how depressed I was, and she didn't know the words TMS, but she saw how depressed and anxious I was, and I would wait for her to come in. I would always get there before her, and I would wait for her to come down this long hallway. So instead of just walking down a hallway like any normal therapist, quotes, normal therapist, she would dance down the hallway to make me smile, just to give me some pleasure. I believe that's the whole reason she did that. So, and sometimes that was the only happiness I had in a week, was watching her dance down this hallway. So what happened was, I wanted to repay her for her kindness.
Yes.
And I didn't know that this was going to be the thing. And I don't think she knew that this was going to be the thing that healed me. Most of there's one other part that really is important to tell, but for now, I decided to repay her by learning the steps to a dance. And anyone that knows me knows I'm not a good dancer. So this took a really long time for me to learn the steps of this dance. So I practiced, and I had my daughters help me. So I learned the steps of this dance, and wouldn't you know it, as I was concentrating and all my attention was learning these steps, which were new for me to do, my pain went down.
Oh my God.
Yeah, and sometimes it disappeared. So, and I didn't know this at the time, because I didn't know the world of TMS.
How do you explain this phenomenon?
Well, I was creating a new neural pathway in my brain.
Amazing, yeah.
Yeah, I had a pain neural pathway, and I had no pain neural pathways. And what the goal is to activate the no pain pathways, so the pain pathways become weaker. Yeah. And you can do that by creating a habit in your brain. And my habit was for joy and learning something new. So I learned this dance for her. And as I was learning it, my pain went away. Amazing. It didn't stay away, but then I'd go back the next day and do more and more. And the fun thing is, I was actually able to do the dance for her in person. And that was the day that I really knew that this was a brain issue. This was a neural pathway issue, not a physical issue.
Beautiful. And can you say, after you have been through this journey, and it is such a beautiful story with a happy ending, what is your relationship to pain now?
My relationship to pain, let's see.
And actually you can talk, because you are also a therapist, you can talk about how people perceive pain. I am curious about you, but maybe you also can talk in general.
Right.
I think that we have a very intimate relationship with our pains, physical and emotional, but let's stick to physical. And you know, correct me if I am wrong, the immediate reaction that comes to one's mind is that we refrain from pain, we reject pain, we oppose pain.
Yeah.
We don't want it, but when you have it as a chronic sufferer, sometimes it becomes a loyal body, like a loyal friend. Not that we want it, but it is,
Mhm.
all the stuff about secondary gains. People are also having gains from their chronic condition, hidden. Do you get my point?
Yes, I do. I do. Yeah, you know what? There's some people get stuck in their pain too, because it's easier to feel the pain than to feel their emotions. And to go into those emotions are more painful than actually feeling the pain, and we don't realize that. But I guess what I'd like to say is I became a somatic therapist because somatic therapy was one of the ways I actually got better. Because we have pain in our body, okay? And we want pain in our body to protect us. If we touch a hot stove, we want the pain. So pain is not always, it's not a bad thing. It really is there as a protection. And what happens is you feel pain in your body, but there's also sensations in your entire body that are not painful. They're just not scary. We have sensations going on in our entire body. And that's what I learned as a somatic therapist. And I also saw a somatic therapist to get better. That's why I became one. That was my whole purpose. So I can help people using the hypnotherapy I learned from Caitlin, or the tools she taught me, using the tools I learned in somatic therapy. But people also, there's a lot to say about pain. I can say there's part of me that's grateful for my pain right now, because my pain actually was here to protect me.
Yeah.
It wasn't here to harm me. It was here to protect me. And the brain doesn't know the difference between a physical threat and emotional threat. A physical threat is interpreted in the body, in the brain, the same way an emotional one is. Such as, fear of losing a job or a loss of a relationship. It shows up it's activated in the same parts of the brain that show up that we see pain. So an emotion that is too painful to process, the brain actually thinks it's doing us a favor and gives us pain.
Yeah.
But once we give the pain a voice and acknowledge it, the pain can go down and go away.
But on the other hand, you say that not to talk about it.
Right. So I didn't talk about my pain with friends, family, but when I was in my hypnotherapy sessions, and even on my own, I did a lot of work on my own in between sessions. I had a lot of persistence. And I did a few things with the pain. What I want to first say is I would watch the pain. I would watch it as I was watching like a TV show or clouds in the sky.
Yeah.
So if you watch it, your brain stops fearing it. And when we stop fearing the pain, it actually can go away on its own too.
This is good.
Yeah. So once you observe it, like as a watcher and observer,
You witness it from the outside.
that's the word I'm looking for. Thank you. And as we witness the pain, as we witness it, it can actually go down because we're not fearing it anymore. That's part of my somatic therapy. The other thing I learned to do in my somatic therapy is I learned to lean into positive sensations in the body.
This is what I wanted to ask you, because you mentioned that we have other sensations in the body, and I don't think it was clear enough. What did you mean? Other sensations which are not painful. Can you make?
Yeah, sure. So basically, and I give people, and I don't know if this can be conveyed in an interview, but if someone even holds their hand out, and I think you could see me holding my hand out,
Yes.
and if you just pay attention to another part of your body, a part that we weren't paying attention to when we were speaking, a part that we didn't even realize, we weren't even paying attention to the fact that we had a hand. But if you hold your hand out in front of you and pay attention to the weight of your hands, pay attention to each finger, you'll start to feel sensations, maybe a slight bit of tingling and a weight. But before we were talking, we weren't even paying attention to the fact that we had a hand.
I love it. I felt the tingling.
Yeah, you can feel it, right?
Yeah.
So that's how I use somatic therapy, to have people lean into the positive sensations of their body, the sensations we're not afraid of, and realizing that there are sensations in our body. So basically what I did was somatic therapy. Basically, what it does is there's stored trauma in the body too. That's the other thing I did. And it didn't have the capacity or the time to complete. So using my somatic therapy skills, I'm able to do that with clients to reprocess trauma that happened in their lives so it can release.
So what is your take on safety, how to cultivate a sense of safety?
Yeah.
Because people with chronic pain, they feel that they are groundless, that they don't have a ground, that they are lost. And
yeah. I try to find, being a somatic therapist, I try to have my clients, or I do have my clients, find a sense of safety in their body. Okay. I do it in two ways. I do it with somatic therapy, with finding sensations, safety in their body, and I do it with messages of safety. Both work. The brain is like a child, a scared child.
right.
And we have to talk to it with compassion, with understanding. The same way if a child was scared, you wouldn't just say to the child, oh, you're safe, you're fine.
Yeah.
The child's not going to get that. But if you say and this is so simplistic, but it works because the brain believes what you tell it. So if you tell the brain, I'm safe, I'm fine, this is just TMS, I don't have to be worried because I've done the evidence. I have my clients do an evidence journal so they, to decide if they have TMS or not, which usually it leans toward that. So you would say, I've done the evidence. I tell my brain, I love it. I love you, brain. Thank you for protecting me, but I don't need the pain right now. I don't need you to protect me anymore. So it's having a nice dialogue and conversation with your brain. And like I said, as simplistic as it sounds, it works, but it doesn't work when you just do it once or twice. It takes time. It's kind of like a puppy. The puppy's not going to get it the first time that it needs to pee and poop outside. It takes patience and perseverance.
But Laura, talking about it, it reminds me, I know it's a bit different, but it reminds me the affirmations that people do in the spirit of the new age. I am abundant, I am beautiful, I am love, my middle name is abundance, all these affirmations.
Yeah, it's the same thing. It's the same thing, but what I like to do instead of just saying I am safe is to have a conversation. Open up a dialogue with it. The affirmations are great, and I still recommend doing them with my clients, but having that open dialogue. The other thing, and I'll get back to the body in a minute, but the other thing that's important is to treat this with confidence.
With what?
With confidence.
But what if the person deep down doesn't believe it?
Well, that's my job. That's my job as their therapist, to guide them and show them the evidence that it is. And I give this analogy too, that let's say you want to buy a new car. okay?
Yes.
And you want to buy a new red Jeep Wrangler. And all of a sudden, once you put that thought into your brain, you see more Jeep Wranglers on the road. There's the same amount of red Jeep Wranglers out there, but now because you've put that thought in your brain, you see more of them. It's the same thing. Once we start compiling evidence, the brain will look for more evidence to make that belief true.
I understand that, but still, I think that it might also, correct me if I'm wrong, people who are skeptical in their nature and they are doubtful, and if they do it mechanically, as you suggest, like fake it till you make it, it might create a dissonance within, and it might create a sense of inadequacy because they feel that they cannot do it because they don't believe it. It's my question if these kind of cosmetic changes from the outside in will not create more dissonance and more anxiety actually. And it has a name. I know. I think Barbara Ehrenreich, which is a researcher, she in the psychologist, she calls it toxic positivity. Because when there is discrepancy between what you really believe and what you are saying, it might create.
Well, that's why I have a criteria that I go through with clients. I have a list, and there's a list of things that makes it more believable that you have a mind-body condition. And I go through the list with my clients and I have them write it down, okay? So we make a concrete list of the evidence why it's TMS. And then in the second column, I have a list of why it's structural. And by the time we compile these lists, the one that is why it's TMS is much longer than the one why it's structural. And when they see it's structural, I show them evidence of people that have the exact same things that do not have pain. They're just called, like I said before, normal abnormalities in their body. So I give them evidence why their physical symptoms don't have to be causing pain. There's also something called the vomit studies, victim of modern imaging technology. I show them those studies, which it shows people the percentage of basketball players with knee damage, the percentage of baseball pitchers with rotator cuff damage. And they showed them, they did MRIs of people that didn't have pain. And they showed them this, they did the MRIs and they saw the damage. So evidence and knowledge are what helps with belief, both things together. And I have charts and evidence that I can show clients that really shift their mindset in their brain. It's not just to fake it to make it.
Like it's their brain is more persuaded now because they see the length of the list of the TMS evidence.
Yeah, they see research basically. So research, an evidence journal. So it is a fake it till you make it because belief actually helps you get better. If a doctor tells you you're not going to get better, you feel worse. If a doctor tells you there's hope that you get better, you feel different in your body. And one of the other things I tell people is to treat this with confidence. So I literally have people stand in a posture pose because confidence, when you have confidence, it sends another signal to the brain. It knows the difference, how it's talking, how you're speaking to it. And when you speak to it with confidence and compassion, and I give people a little script of what to say every morning so that their brain hears it. So when you treat your brain with confidence and compassion, it can heal. Now, the other way I find safety in the body is just with somatics and using specific grounding techniques, just feeling parts of the body that feel good and showing people that there are parts of their body that feel good. And let me tell you, there might just be their ear that day. It might just be the tip of their nose that feels good. But
What
seeing,
does it also build a new pathway in the brain?
yes, starting to lean into positive sensations can create a new pathway in the brain. No, it's no pain pathways that you have that are already there. We're just activating them so that we can decrease the pain pathways.
Wow.
And eventually the pain pathways will go away.
Beautiful. So the last question is, if you have to instill one insight from your own personal experience and from your professional expertise, and if you have to talk to people with a chronic condition, not necessarily pain, but people that are in the doom and gloom, in the lowest position in their life, as you said, on hands and knees, what would you tell them?
The first thing I want them to know is there is hope. I don't have the cure for pain, but there is a cure for chronic pain.
I love
Everyone has, that's where there's a difference. Everyone has pain in their lives, but no one has to have chronic pain.
Beautiful.
Yeah, that's the most important thing, that there is hope, there is healing. Don't give up.
Yeah.
Don't give up. Put the time into yourself because you're worth it. Move past the physical, as hard as that is. Move past the physical and dig deep into the psychological.
Wow.
Take time to reduce your stress level. Take time to meditate. Take time to be mindful.
Slow.
Yeah, slow your life down. I healed, and I am no different than any of you.
Wow. Thank you. I think it's a good point to wrap here. Laura, I want to thank you so much for this genuine, authentic, beautiful testimonial. I am sure it will inspire others like it inspired me. Thank you, and may you have always health and joy.
You too, you too. I mean, it was a pleasure talking to you, and I appreciate you taking the time for people to hear my story, because if I can even help one person, then it was worth it.
Thank you. So